8 votes yes and 3 votes no. The motion passes.
A group of vaccine advisors on Friday scrapped a long-standing recommendation that all U.S. children receive the hepatitis B shot at birth. The decision is a major policy win for Health Secretary Robert F. Kennedy Jr., that disease experts say will reverse decades of public health gains. Emergency medicine physician Dr. Cody Meisner was among those on the panel that voted against the change.
And I will just say, we have heard do no harm is a moral imperative. We are doing harm by changing this wording, and I vote no.
The committee voted to keep the birth dose only for infants whose mothers test positive for the virus. This replaces the 1991 universal recommendation that has protected all children from hepatitis B infections, which can lead to serious liver disease. For infants of mothers who test negative, the panel recommended that parents, in consultation with a healthcare provider, should decide when and if their child will begin the vaccine series. Public health experts decried the move, saying that a decision to shift to shared clinical decision-making would create obstacles to the use of vaccines and lead to more infections. Dr. Heather Bradley is a professor of epidemiology at Emory University Rollins School of Public Health.
When we stop doing a good job with universal vaccination, we will start to see new infections, and that will be a legacy of new infections that start to really infiltrate the population.
The committee advises the U.S. Centers for Disease Control and Prevention on which public health recommendations to adopt. The recommendations affect U.S. health insurance coverage and play a key role in assisting physicians who are choosing appropriate vaccines for patients. Kennedy founded the anti-vaccine group Children's Health Defense. In June, he fired the previous 17 independent experts and replaced them with a group that largely supports his views as part of an effort to remake U.S. vaccine policy. This is the most far-reaching of the changes, which have included dropping broad recommendations for the COVID vaccine, cutting funding for mRNA vaccines, and advising pregnant mothers against taking Tylenol, saying without scientific proof that studies suggest a link to autism. The World Health Organization recommends all babies receive the hepatitis B vaccine as soon as possible after birth, followed by 2 or 3 doses of the shot at least 4 weeks apart.